Hi, nice to see you. Would you mind introducing yourself before we start?
I'm Vera Paiva. I'm a psychologist by training, working with public health for a long time, and a professor of the University of Sao Paulo, Brazil.
And we've known each other a long time. We've worked together a long
Yes.
time, over many decades. COVID has shown that even people who didn't realize it and work in it, the inequities in our societies. And I think, Brazil, I'm sorry to say, is almost as bad as the United States right now in terms of your president, maybe worse. If you could say something in terms of, for those of us that are not in Brazil, just something in terms of some of the policies around COVID that are most of concern right now in terms of what the government is doing.
The federal government is against any kind of, he's dismantling any kind of policy. It's just a nightmare. We have a very we did have, we don't have it anymore like that, but we did have a very well put and organized and structured universal health system for free and for all, right? It has been dismantled since for the last 4 years, and this government just don't care about it, just doesn't care. And we now in the Ministry of Health have a military who has not a training on health. It's a nightmare. It's a nightmare. It's like a lot of people in military clothes with boots and booting down any kind of technical expertise. Bolsonaro just inaugurated the first hospital. He didn't say a word about COVID. He made a discourse calling people to get guns and defend the government. This is the federal government, right? But then the local governments are doing much better, right? The problem is it's a mixed message. The federal government says, you need to go out. This is not a problem. Go to work, go to work, go to work. So this resonates with the need to be working, with the need to get out. So it doesn't help at all, right? But we are doing the best we can.
I was just going to ask you in terms of good examples from local government, in terms of what local government is doing to address COVID effectively. But I really hear you that the biggest issue isn't so much even if the local government is doing well, it's about how people hear what the local government is saying, but also what the national government is saying.
Yeah, because you know what Bolsonaro is doing? He's inviting people to invade hospitals, go into the hospitals and show that there is a lot of beds that are empty, and the data is not true. So in the last 10 days, we are having mobs of people that are invading.
It sounds like a ridiculous question, but invading them to do what?
To picture and show that there are an empty bed. So it's not an emergency. Even when they do the right thing, which is having this many emergency hospitals just to attend and care for COVID, right? In many places, this is a good thing they are doing. They are being attacked by people who are there literally invading, hitting health professionals, invading nursing, where people are there being treated. It's like it's really a fascist movement. It's very scary, right? And I mean, there is a part of the judiciary who is trying to put these people in prison, but then there is resistance from the military police, right? Which is most of the military police are with Bolsonaro. The military, most part of the military are inside the Ministry of Health trying to deny. We had this experience during dictatorship. We had a huge meningitis epidemic that was like, you couldn't say we were in an epidemic, but they are trying to do the same.
They're trying now to hide the fact that so many people are dying.
Yeah, so it's very difficult, even when they do the right thing. And the worst thing is that no testing at all.
Okay.
Very bad testing. We don't do tests. It's very difficult to control and to cope with the long-term epidemic that we think I think there is a pandemic which is globally, but there is a local epidemic that is mediated by government, by culture, by structure, by history, right? Our epidemic will be long, I think.
The last question, really is when we think about everything that's going on, and in terms of all of these experiences, what do you think we're thinking about kind of key lessons we can learn from this as a society?
The first one is that democracy is not done, never. It's not, can be defeated, right, very quickly. This is the first one. And institutions need to be rebuilt and repowered every generation. That's my first lesson, because public health and public policies that, for example, poor people needs public policies to survive, to eat. Women need public policies not to suffer domestic violence, which is 35% higher than it was. We need public policies, right? And public policies need democracies, need institutions. Now, lesson 2, we need to stop describing this, denouncing it, and inventing, as Paulo Freire would say, feasible practices. Social distancing, for example, we have been putting this down. We prefer, we learn with the community to use physical distancing, because it's not about social distancing, it's about physical distance, 2 meters physical distance. So you can go out if you do physical distance, but not social distance, because we do need a lot of solidarity, right? Which is not social distance, it's the opposite of that. So to speak the language that people can adapt to their real life. We have a good experiences with young people who are doing protests, like in the US, going out in the streets and doing a lot. The young people are with masks, but are trying to make a world of not. That's what we need now. We need to adapt to real life of real people, prevention message that is allowed into their lives.
So thank you for this. I really appreciate you taking the time. Okay.
Bye-bye.
Bye.